Hello, my name is Mike Clagg, and I'm chair of the Association of Schools and Programs of Public Health Legislative Committee and dean of the Johns Hopkins Bloomberg School of Public Health. I want to thank you for joining this ASPPH webinar and conference call. The focus of today's session is the impact of the 2016 elections on academic public health. When we originally scheduled this webinar conference call, most of us expected a different election results and that we would be dealing with both a different set of actors and a different set of issues. While the election results may have surprised us, the public health challenges facing the country and academic public health have not changed. Earlier this year, the ASPPH membership wrote a document that was shared with all the transition teams titled Academic Public Health's Priorities for America and subtitled Advancing Public Health Education, Science, and Practice as the basis of improving population health. That report outlines challenges and aspirations that remain relevant, and they are not at all partisan. The report is available on the ASPPH website. Just search priorities. We're pleased to have with us today two keen observers of both policy and politics, former Congressman Henry Waxman and former HHS Deputy Secretary Bill Core. If you have any questions you would like to ask our presenters, just type them in the question box online. Alternatively, you can email questions to advocacy@asppph.org. Given the large number of participants on today's call, close to 1,000 people in our sites, we may not get to all your questions, but we'll do our best. We have asked Henry Waxman and Bill Core to share their insights with the academic public health community. But before we do that, just a few words about both of our presenters. Representative Henry A. Waxman currently serves as chairman at Waxman Strategies, a public affairs and strategic communications firm. He advises clients on public policy and continues to focus on the issues he championed while in Congress, including healthcare, environment, energy, technology, and telecommunications. In addition, he serves as Regent Lecturer for the University of California, Los Angeles, and is an advisor, lecturer, and Centennial Scholar at the Johns Hopkins Bloomberg School of Public Health. Previously, Henry spent 40 years serving in the House of Representatives. He had the distinction of serving as chairman and ranking member of the Energy and Commerce Committee and Committee on Oversight and Government Reform. He also served as chairman and ranking member of the Energy and Commerce Committee's Subcommittee on Health and the Environment. Henry's legislative work and tenacity has earned him recognition as, quote, one of the most accomplished legislators of our time by Washington Post columnist Harold Meyerson, and, quote, tougher than a boiled owl by Senator Alan Simpson when pushing for passage of the landmark Clean Air Act amendments of 1990. Bill Core has spent the bulk of his impressive career advocating for better health care access at almost every level of society. Most recently, he served as Deputy Secretary of the Department of Health and Human Services from 2009 to 2015. Bill returned to the department after serving as Executive Director of the Campaign for Tobacco-Free Kids, a very effective privately funded organization established to focus the nation's attention and action on reducing tobacco use among both kids and adults. Bill joined the campaign in March 2000. From 1998 until 2000, Bill served as Chief Counsel and Policy Director for U.S. Senate Minority Leader Tom Daschle. Before working for the Senate Minority Leader, Bill served as the Chief of Staff for the Department of Health and Human Services. In that capacity, he was Principal Advisor to Secretary Donald Shalala for all major policy and management issues and initiatives. Congressman Waxman and Mr. Core, we really appreciate your joining us and look forward to hearing your thoughts on the impact of the election on public health and the issues on which both of you have worked on for so many years. Just a reminder to listeners, feel free to submit questions by typing them in the question box on screen or by emailing them to advocacy@asppph.org. So, Congressman Waxman, I'd like to ask you first to say a few words, and then Mr. Core, if you would. What are your thoughts?
Well, when I agreed to this opportunity to talk to the members of the Association of Schools and Programs of Public Health, I did also expect a different result in the election, and I thought it would be interesting to talk about what will be happening to expand the access to health care, make sure that we connect healthcare services with prevention of diseases, and that we keep a public health focus on our national policies. But with the election of Donald Trump and a Republican Congress, we have something we haven't seen in quite a while, and that's one party in control of the House, the Senate, and the presidency. Republicans had passed, since they had the control of the Congress, repeal of the Affordable Care Act at least 50 times in the House. And it never went anywhere until last year, when they finally got a majority in the Congress to pass a reconciliation bill to a budget that would have repealed the law, but it met with the veto of President Obama. Now one would suppose that if the three branches got together, they could repeal the Affordable Care Act and make dramatic changes in health policy. But the thing to keep in mind is that we have three different groups. The House has one point of view, the Senate has a different point of view, with members in each group of body that will be, and in the Republican ranks that will be trying to reconcile their points of view. And then we know some of the things that President-elect Trump wants the Congress to do. He's for the repeal of the Affordable Care Act, but he wants to keep certain parts of it, such as leaving children on their parents' policy to age 26. And he likes the idea of not discriminating against people with pre-existing medical conditions when they try to get health insurance. Well, we have to reconcile how they can do that without, in the course of repealing the Affordable Care Act, repeal it in a way that will completely disrupt the insurance markets. The Republicans have been saying since 2009 that they wanted to repeal the Affordable Care Act and replace it. But now we still don't know what their replacement would be. And it's not clear they even know what their replacement would be. We've heard some sketchy ideas, but nothing specific. We've heard that they want to move quickly in this beginning of this next Congress next year to repeal the law, but not to offer the replacement until later. And the talk is that they would repeal the law to take effect in 2 or 3 years. And during that time, they would either come up with their replacement or perfect the sketchy things they might throw into the legislation. They have the opportunity to do this, notwithstanding the fact that they don't have a 60-vote margin in the Senate, which usually is required to stop a filibuster, because the budget process only requires a majority vote in each house to pass the budget, and then to enact legislation afterwards to meet the terms of the budget that's adopted, and that's called a reconciliation bill, and that also only takes a majority vote. And at that point, it would go to the president to sign the legislation into law. So that if they get their act together, they can repeal the Affordable Care Act and replace it or put parts of replacements in place. And we could expect certain consequences. We could expect that people who couldn't get insurance in the past because they couldn't afford it, and who have had subsidies to help them pay for their insurance, would lose those subsidies. And while people who have pre-existing conditions may or may not be discriminated against, in the process of not discriminating against them, if we don't help them pay for an extraordinarily high cost of insurance because they have these medical problems, they probably wouldn't be able to buy insurance either. And there are enormous consequences to the other parts of the Affordable Care Act, which looked at how to hold down health care costs, how to prevent diseases and expand our public health approach. to dealing with health issues. So it's not just medical services, but medical services that would make available to people screenings for identifying diseases early on and trying to find ways that could keep people healthy. So with those comments, I'm going to have Bill Corr pick up and say some words, and then I guess we'll be available to answer questions that you might have.
Yep. Thank you, Henry.
Thank you.
And thank you, Mike, for the introduction. Let me just touch on 2 points that I think will be of interest to all of you listening. The first is, as I look at the association's specific priorities for the new administration, you've listed 4 in this very helpful document. I personally feel like the current administration has really focused on these kinds of public health priorities and has made substantial progress working towards them. A substantial amount of new resources were included in the Affordable Care Act for public health, but also a recognition that we needed preventive services, that we needed expanded workforce, that we needed community transformation grants. There's a wide range of resources that I'm sure you all are familiar with that were focused on these kinds of priorities. And I think we have to be very realistic that the resources and possibly even the priorities are not going to be supported by the incoming administration and the incoming Congress. And then one of the primary reasons they're going to have difficulty supporting these priorities is because of their approach to their top priorities. The president-elect has talked about a defense buildup. He's talked about a major infrastructure, tax credits. He's talked about major tax cuts for business and for individuals. In repealing the Affordable Care Act, there would be an increase in the deficit. So that with all the other priorities that this president-elect has enumerated, and with the Republican Congress's focus on deficit reduction, there's going to be enormous pressure on resources like those for public health. And I would urge each and every one of you on the phone and listening to fully understand the risk at which our public health programs will move forward. It's not that people don't support good public health. It's that if we're going to have the resources to actually implement these priorities of preventing disease and injury and disability and integrating affordable quality medical care with public health and eliminating inequities and promoting social justice, for us to pursue these kinds of priorities, it will require focused attention and continued resources. And that's only going to happen if we all who care about public health make our voices heard loud and clear. So I would urge all of you to pay very close attention to where the discussion over the next few months proceeds. And as you know, we've got a HHS Secretary nominee, Tom Price, who is a physician and who will be in charge of the department. I'm sure that Congressman Price understands the value of public health, but when it comes to putting resources in this next Congress towards public health, that's the fight that we're all going to have to engage in if we're going to succeed. Thank you, Mike.
Thank you, Bill, and thank you both for your passion and your support. Let me just follow up, Bill, with the first question, which really deals with the point you made about convincing the administration. The question is, what kind of messages or narratives do you think would appeal to a Republican-controlled Congress and White House to help demonstrate the importance of public health and prevention?
Well, I think there's a major theme. One quick answer is there's a major theme that starts with the Speaker of the House, Paul Ryan, when he talks about individual responsibility. And that certainly, we all know, starts with taking care of oneself, and it's one of the best ways to live a healthier life. But we also have to recognize that we've got serious challenges to enabling people to live a healthy life. First of all, is having access to health care when they need it, but also is an emphasis on preventive services, prevention and integrating prevention and care for those who are ill, but also tobacco prevention, nutrition labeling. There's a wide range of issues that are very important that require governmental action. And I think we have to make very clear that as with so many things that we value in this society, that we've got to put resources behind it if we expect to succeed in having a healthier community.
Okay.
And it's not just public health programs. You know, it's housing and it's education and it's a wider range of things. And it's making sure that our leaders in the Congress and in the White House understand what it takes to improve public health and to have a healthier country.
Great, thank you. So Henry, let me ask you. You were a champion of AHRQ, and both of you made the point that some of that the ACA is under threat, and with that, it was funding for PCORI. Do you see a major attempt to defund PCORI and AHRQ in the new administration? And what can we do if that happens?
I think that there will be efforts to repeal those parts of the Affordable Care Act that might not come up front, because if they use the budget process, which allows them to pass things with a majority, they have to evaluate whether they can do everything. But insofar as they cut money out of these programs, even if they don't change the language that authorizes them, they can make them completely ineffective. The thing to remember about the Affordable Care Act is most people think about it in the narrow terms of giving people an opportunity to buy insurance in the individual market for those who don't have insurance coverage through their employment or through Medicare or even Medicaid. And to cover those who didn't have insurance, we provided subsidies to help people who buy their insurance. And most of the people that have bought insurance in this individual market have had subsidies. We also not only provided subsidies to them, but made sure that when they buy a health insurance policy, it has certain basic provisions available to them that would be covered. All the medical services, but also preventive services. And we tried to make sure that some of the preventive services would not have copays, so that we wouldn't have a discouragement of people to take advantage of things like immunizations and the other practices. But the Affordable Care Act was so much more than just an attempt to deal with the people who didn't have access to health insurance. It had a whole section on women's health and reproductive rights. It had a whole area on prevention, money for prevention services, not within the individual health insurance plan that might be agreed to in the exchange, but for integrating our healthcare system, whether you got it through the exchange, individual market, Medicare, the employer market, or Medicaid. We try to provide a more coherent healthcare system that people would have access to. Well, the Republicans' approach has not been to have a coherent package of benefits. They want to do things like provide for health savings accounts so that people can take money and put it in an account where they could earn money. If they didn't use that money, they could get a tax break when they put it into the account. They wouldn't have to pay taxes when they took it out of the account. But the people who benefited the most were people who had more money. They not only wanted that, they wanted to have things like a catastrophic coverage that would follow the health savings account. And rather than have everybody covered, and not discriminate against those who had previous problems. They wanted to have high-risk pools. And if you have a high-risk pool, it would take the people that are higher risk for getting sick and having money spent on them and put them in a pool with other people who have medical problems rather than pool them, the sick and the healthy people together, which spreads the cost. And that, of course, would drive premiums up for those people getting their insurance through a high-risk pool. It's never worked particularly all that well, and the premiums go so high that a lot of people wouldn't be able to afford it. And then their last proposal seems to be to allow insurance companies to sell plans across state lines. Well, if your state doesn't think an insurance company or its plans are going to be adequate for their people or have enough consumer protections, they don't want to open up their insurance market for those plans to be sold. But if you have an inadequate plan that's for sale in Alabama, why should people in Maryland want to buy that plan? It may not even cover the full range of services, and the only advantage of such a plan would be that it'd be less expensive. There'd be a race to the bottom. We have available to us insurance plans that may not even cover prescription drugs, may not even cover the full range of medical services, certainly wouldn't have public health and prevention available to those who are covered. So we would be stepping, I think, backwards, and certainly away from a full coverage, affordable coverage, and convenient access to health care for every American. And I think we will have more uninsured, certainly more than we have now. The Affordable Care Act provided health insurance coverage for 20 million Americans. Well, those are a lot of people to jeopardize in some kind of experiment that the Republicans may want to undertake for HSAs and high-risk pools and other things that they've been talking about for years, where the consumer would have to be carrying the risk for their care, not because they're taking the risk they have to keep themselves as healthy as possible, but taking on the risk because if they do need medical services, they have to figure out where they can get those services in the least expensive way, or forego getting the services at all. So it's going to be a big change to our healthcare system.
Right. So the message I get from what you said, you're both saying, is that we have to articulate these issues, quantitate them, and create advocacy, give people evidence so they can advocate for a more rational policy.
That's right, and try to illustrate what it will mean in people's lives. And you have to also recognize that the Republicans would like to change the Medicare and the Medicaid system to make them not entitlement programs where when you're eligible you're entitled to a full range of benefits, but to make them programs where you can get some help, but you have to go and buy your own insurance policy. I don't think they'll be able to do that for Medicare because the people on Medicare are too strong a constituency. But they've always wanted a block grant Medicaid, which in effect shifts the cost to the states and tells them, you don't have to do anything that you now have to do, but just use the money and add your state dollars and extend health care for those who need it as long as the money lasts. And of course, if that money doesn't last, they'll just have to cut back on things like prescription drugs, preventive services, cover whatever they can. On a block grant, it could be just a sum of money to the states, straight block grant, which was within the bill passed by the Congress last year, that was vetoed by President Obama, or even in a per capita block grant, which some Republicans have argued would be a better way to do it. But it wouldn't be as generous and it wouldn't be as complete as Medicaid has been since 1965.
So we need an AARP for poor people, an AARP equivalent, right? let me ask Bill.
And AARP, I care about these things as well because Medicaid pays a lot for the services, for the premiums for people on Medicare who can't afford to pay them, and the long-term care costs, whether it's a nursing home or some more limited care to keep people out of a nursing home when they don't have the ability to take care of themselves and meet their daily tasks of living.
Thank you. So Bill, you had a leadership role at HHS. Somebody asked about how we can combat the epidemic of misinformation about vaccines and the effects of environmental degradation on health. And they're worried that anti-vaxxers and climate change skeptics are being appointed in the new administration. How do we fight that battle?
Well, just thinking about the department, I think it's important for you to physically show up in meetings with leaders in the department. It's very important to get to know the new leaders early on in the administration. There will be policies being formed, where the Department of Health and Human Services will be working with the Hill, and I think you've simply got to go in and engage people. Now, there are many ways, to communicate the policies that we care about in public health, but one most important would be for your leadership and for individuals, many of who are on the phone, to talk to your members of Congress, but specifically meet with the leadership of the department, and think about the various parts of the department. I wouldn't ignore the Assistant Secretary for Financial Resources, who's the Chief Budget Officer. I wouldn't ignore, of course, the Assistant Secretary for Health, the Secretary and the Deputy Secretary, the leader at the Center on Medicare and Medicaid Services. You have to engage every one of those individuals and forcefully talking about the evidence that we've got about the value of the programs that we care about and a public health approach. And at your organizations, your schools, I think in every opportunity requires repeating the messages. But I think having been in the department, I can tell you that that very quickly the leadership of the department gets focused on the problem of the day, and they have a very hard time really looking forward and talking about major new developments and what the most important priorities need to be. And so that's why it's important to engage early and to engage vigorously.
We have a president-elect who said during the election that he thinks vaccines can cause autism, which is, of course, contrary to science. And we have a new Secretary of Health that is so ideologically opposed to abortion that he wants to also keep a tight lid on women's access to reproductive rights, reproductive health services, which, of course, involves contraception as well as termination of a pregnancy, which is legal in this country. So we don't know where they're going to go on some of these policies. Maybe the president won't be all that hands-on, although in some ways he could be helpful, because he did argue in his campaign that he thought Planned Parenthood did a good job of screening women to prevent diseases, and that would be helpful to overrule his Secretary of HHS, who doesn't want to support Planned Parenthood. But maybe neither of them will be as hands-on on these policies and allow others in the department to pursue the details. And details matter. They matter in the legislation, and they matter in the enforcement of the legislation.
Okay. There have been several questions about the effect of the election on NIH funding, and especially NIH funding to improve the health or investigate the health concerns of the LGBTQ community. What do you both think about the NIH and what's going to happen, and will we see a reaching in at the program level to try to influence the kinds of grants that are funded?
Well, the Congress also seems set before this year is up to pass a bill called the 21st Century Cures, which would try to encourage more investment in research and development of ways to cure diseases. And they originally provided automatic funding increases for NIH and FDA and I think the CDC, but they've instead settled for 1 year good funding levels, but every year after that it would be a race to the Appropriations Committee to see if they can maintain that level of support. But it indicates a strong view of the Congress that they back NIH. In fact, some of the Republican leaders in the Congress have said that they would like to see the present head of NIH continue in his position. Look, the public health and research investment and trying to find cures and ways to control disease are overwhelmingly popular with the American people, and we've got to keep pressing to be sure that the support of those efforts are maintained, especially at a time when the government is going to look to cut back on spending in this area, so they could divert more spending to tax breaks, often to people who don't need it, especially at the higher income levels.
Bill, do you want to comment on NIH funding at all?
Mike, I would just add two quick things. One is, historically, NIH, as you all know, has had bipartisan support, and it continues to have bipartisan support. But that doesn't mean that you can assume everything's going to work. I think there will be pressure to not follow science, but to follow a moral agenda. And I think it's very important that if this administration crosses that line, that they get called on it. I think there will be a lot of continued interest in raising funding for NIH. NIH speaks very clearly for itself on that and will continue to. But I think all of our priorities are going to be put at risk in the health world, including NIH, by the need for this administration, if the president follows through with, as I said earlier, his defense buildup, the infrastructure spending he's talking about, the tax cuts, the repeal of the ACA. There's going to be very few dollars left for very important health undertakings, and the only way that equation is going to change is if we are very clear in our demands on the Congress and our clarity about what's important to the American people.
Thank you. So a student who's in a school of public health has asked, what's going to be the impact on jobs for public health graduates? What advice do you have for young professionals interested in advancing public health despite the new climate in Washington?
Well, I think that people who are studying in schools of public health shouldn't be so discouraged that they abandon their chosen profession. There is still going to be a need in government for people who know what they're talking about and can be a part of the administration of these federal programs. They're all not going to be deleted. But it's important that these voices are on the inside, speaking to those who are making the decisions, both at the national and the state level. We need people who have a public health background to advise the Congress so that they can meet wise decisions. And there are other places in the healthcare system where those who are trying to make sure that the needs of patients are met in the most effective way are giving the best guidance to those who are designing the healthcare systems where people will get healthcare. It may not be as generous as what we have spelled out in the Affordable Care Act, but we've got to continue to fight for those public health priorities, prevention priorities, and people who have been trained at schools of public health can play a unique role. And then we're going to need more help with the nonprofits in this country to fill in the gaps if government's not doing what it should. And then we need people who can talk truth to power, because I remember when Reagan was president, and he sought deep cuts in domestic programs, including health programs. We didn't cap the Medicaid program as he had proposed, but we had to reduce the federal dollars that went to the states for Medicaid. And when that happened, the states were not as able to do what they needed to do. We saw then a big increase in people going without basic needed services, which aroused the public and allowed us to come back and correct the problems later. So there's still a need for professionals in public health at the governmental level, the nonprofit level, and at the academic level to keep alive the idea that we're just not going to patch people up and ship them out of the emergency room of a hospital to fend for themselves, but we're going to look at how to prevent, treat, cure illnesses and keep people healthy.
Bill, you were at an NGO, right? What's your take on should this person pay their next semester's tuition or not?
Oh, absolutely. I think Henry hit it exactly right. You can look back over the last 30, 40 years, and there have been moments like this. 1980, when President Reagan was elected, in the early 90s, when the House and Senate began to shift parties, and there have been several occasions where it felt like there was going to be a wholesale change in direction and in the country's priorities. And it just requires those of us who care about public health to stand up and speak. And I would, to the contrary, would urge anyone in public health school to recognize that their expertise is going to be even more invaluable in the future as the country grapples with how do we bring down our spending on health care but improve our health outcomes. And we know what the answer to that is. It starts with prevention and public health and education. And so I think there's, no matter how it feels right now, public health graduates are going to be people that we're all looking to for leadership as we go forward.
Yeah, I couldn't agree more. I think civil society in general, but especially public health, is incredibly important right now for all those things you both said: generating evidence, finding rational policy, and then having evidence-based advocacy. So let me move on. It's been a great discussion. We're about halfway through. Somebody asked whether the 21st Century Cures Act would take funds from the public health funds. So, Henry, you know a lot about the legislation. Where's the money coming from for 21st Century Cures?
Well, I'm gonna punt that over to Tony Sasachi, because he's more familiar with the day-to-day discussions on this bill.
Okay.
Yeah, the bill that's being considered actually today by the Senate would take $3.5 billion from the Prevention and Public Health Fund scheduled increases. The base level of the fund is not touched, but the ACA did provide for step increases in the prevention fund, and they tacked that expenditure as one of the pay-fors in the bill. That said, the base amount is very much in danger as they move forward. If they do a repeal motion on the ACA, that's one account that they might terminate immediately and not wait 2 or 3 years. So we've been advocating strongly. We opposed taking the money from the prevention fund for a pay-for, but it did pass, and it's likely to pass the Senate either later today or tomorrow.
Okay. But that fund's been raided in the past, right? This won't be the first time that fund's been used for other things.
It's been proposed as a pay-for before, but all those efforts have been unsuccessful. But this one's going to be successful. Right?
Yeah. Okay. So we have another student who wants to know, with regard to pre-existing conditions, will the Ryan plant or other plants go back to underwriting? What would be the mechanism for dealing with pre-existing conditions?
If you have a pre-existing condition, you'll have to pay more for your health insurance.
Mm-hmm.
If you are unable to find health insurance on your own, many of the states could enact high-risk pools and put some money into the high-risk pools to help hold down the costs. But we had a provision while the Affordable Care Act was being phased in to provide health high-risk pools, and we just couldn't afford them. So whatever the circumstances, the costs will go up, and people with these pre-existing conditions will have to do the best they can to afford whatever will be available to them. Do you have anything more on that, Bill?
No, I think that's right.
I think that was one of the accomplishments. One of the reasons that we had so many people uninsured is because they couldn't afford to buy or didn't even have it available to buy insurance when they had pre-existing medical conditions. That underwriting included them, either financially or in fact. And then the other big problem was that people couldn't afford it even if they were basically healthy. So we provided subsidies to help them pay for their insurance, and that will be out the window if this repeal vote goes, if and when this repeal vote goes through.
Someone points out the irony that some of the Republican states that went heavily for Trump are the ones with large populations of low-income folks who benefited the most from the ACA and from coverage. And ask how we get that message across to those states, to people in those states, the benefit that the ACA provides. What's the best way to do that?
I think they need to be educated. They weren't educated sufficiently before the election to realize that they had something that was fragile politically and may not even exist if Trump and the Republicans won the election. But it's going to be a challenge for them now that they control the government. They have all three branches, so to speak, of the two of the Congress and the executive, to be held accountable. The Republicans had the opportunity to pass all sorts of bills they knew weren't going to be law, and because they were going to be vetoed by President Obama. They now have to be in charge and be responsible, hopefully act responsibly in their legislation, and be held accountable should their legislation cause a lot of misery to people, as I suspect it will, if they repeal some of the fine points and important points that have been written into the existing law, the Affordable Care Act.
Let me ask you, transmit a question somebody asked about funding for student loan repayment and for helping students afford higher education. Will the new administration, the new Congress, be friendly towards those programs, or are we going to see a retrenchment?
I don't know. We haven't seen a lot of support for some of the efforts to allow those who have student loans to be able to refinance those student loans in the past. But I think that this problem is getting more and more severe, and maybe we can find a bipartisan way to approach it. I think, to be fair to all parties, a lot of the efforts to push students into getting loans that are hurting them so much in the repayment were bipartisan, with the expectation that this would help people get an education and they'd be able to pay back the loans. And so some of these loans have been guaranteed by the government and leaving the taxpayers on the hook, where a lot of the for-profit schools, not particularly schools of public health, but a lot of for-profit colleges and Trump University is probably a good example, could have students get their loans and then pay the tuition and then not get anything from the school that was worthwhile to allow them to make a living after they finished their education.
Mm-hmm. Okay. So, Bill, your thought about loan repayment and other programs with the new Republican government?
Well, I would go back generally at this point to what I said at the very beginning. The president-elect has talked about some of the largest spending efforts we've ever undertaken with his tax cut and infrastructure focus and the defense buildup. And we've got a Republican leadership in the Congress that has been preaching deficit reduction and budget control and returning things from the federal government to the state government. So I think there's going to be enormous pressure on non-defense discretionary spending. I think everyone, as Henry said, I think generally agrees that we've got a serious problem, Democrats and Republicans, about student loans and how they can be repaid. But whether we're going to have the resources to address some of these social domestic issues is to be seen. And the only way it's going to happen is if the public and all of us who care about these issues makes our voices very loud and clear.
Mm-hmm. Okay. So somebody asks, what are public health leaders like yourselves going to do during trying times to uplift, center, and act on the voices and experiences of those most impacted by rollbacks and evidence-based practices? Are we listening to and promoting poor women and women of color, their voices?
Well, we'll do everything we can to support them. We're not in government, mm-hmm. So I'm not in Congress to talk about it. And certainly, if I had been in Congress, I wouldn't be in a position to call the hearings because the majority party controls that. Bill is not in the Department of Health and Human Services, but we're part of an outfit called Waxman Strategies, and we're looking to help clients who are often the safety net providers, well, mm-hmm. for the most part, safety net providers that are trying to make sure that they don't get passed over. So we represent the public hospitals in California, 340B clinics and hospitals who get a break on the high cost of drugs because they serve low-income patients. We've been representing the Planned Parenthood, which very much is a target because of the ideology of some Republicans and some who should know better, supporting defunding Planned Parenthood. They cannot use any government funds for abortion. So what they do is providing screening for women for breast cancer and other diseases, and they become the primary care providers, especially those who have nowhere else to go. We represent the community health centers, again, safety net providers around the country. So we're going to be fighting for the safety net providers that we represent and help them get the message out that will be part of the efforts of those who care about public health and low-income people and disparities in healthcare services, mm-hmm. Both based on race, gender, and economic viability.
Mm-hmm. So a question is whether the President-elect Trump emphasis on infrastructure provides an opportunity for us, providing safe water, upgrading water infrastructure, and a variety of other things, wastewater treatment, safer streets, walkable communities. Are these opportunities for us to use that emphasis on infrastructure building to improve the health of communities?
Mike, I think it's we all haven't seen the details of the President-elect's infrastructure proposal, but it sounds like, at least the little that I've been able to see about it, it is not the sort of classic public infrastructure development of roads and bridges and water systems, et cetera. It is tax credits for investors who engage in private development of infrastructure-like entities and activities. So it's not that some of those things aren't valuable, but it does not include your classic public infrastructure work. So I don't know whether, I mean, it sounds like Flint, Michigan isn't going to find any other community that hasn't gotten to that point and wants to improve its public infrastructure, that they're not going to find resources. And one of the criticisms of it that I've heard so far is that many of the activities that are eligible for this kind of tax credit are already underway, and it would allow investors to take a tax credit for something they were otherwise doing. But they would be privately owned infrastructure. So we're talking about toll roads, not new bridges that are on the list of those that need to come down. So it's we need to see what the President-elect's infrastructure proposal is, but there are very serious questions about whether it's going to provide the employment that he's talking about, and whether it will provide the opportunity to address the serious public infrastructure problems.
Just contrast this idea of tax breaks for the investors with the infrastructure bill that was adopted when President Obama became president, and President George W. Bush had put through when there was a dip in the economy while he was president. The idea of infrastructure spending was to use public funds to give a spurt to the economy by providing more jobs and doing things that needed to be done. I worked on the stimulus bill when President Obama first took office, and we were putting money into things like renewable fuels and energy. We were putting money into telecommunications and highways, but in the medical area, providing a better infrastructure for doctors and hospitals and other healthcare providers to follow their patients' needs. And we're trying to think of investments that would have a payoff in providing jobs, but also a payoff for making our economy stronger. President-elect Trump did talk about these kinds of infrastructure investments, but we haven't seen his proposal. I'm not going to prejudge the idea of tax breaks being a bad way to do it. Maybe we would give the incentive for more money for infrastructure, but it strikes me that if we give a tax break for people who have already invested in some of these projects, that will just mean more money in their pockets. And I'm not sure we're going to get the payoff from that, but I'm sure that they will get the payoff for it. And many of these people will just avoid paying income taxes, as we saw even Donald Trump avoid taxes for a long period of time because he made investments in real estate tax havens that balanced off his income so that he didn't owe any money. So I think we ought to look very critically at how the infrastructure spending will take place, and to try to work together on a bipartisan basis to get a good bill. I know that Hillary Clinton was going to use this opportunity for infrastructure spending as well, and Democrats and Republicans should get together and do something that will help the country, especially at a time when we've had low interest rates and we could borrow more money at a cheaper cost to do things that will help our country's economy.
So we have about 5 minutes left, and there are several questions that relate to two issues. One is climate change. How depressed should we be about climate change under the new administration? Is it just going to be climate change denial, or is there some hope? And the other is on the issue of mental illness and especially opioid addiction. And the Affordable Care Act did improve health care for people with mental illness. Can the opioid epidemic be used as a way to argue for maintaining those benefits?
Well, the 21st Century Cures Bill, which looks like it's going to pass in the next couple of days, incorporated a mental health bill that had been pending in the Congress and did provide more effort to deal with the opioid epidemic. The other question that you asked about what we can do about climate change. Yeah, thank you. Climate change. I'm fairly discouraged because the attitude has been in the hands of the deniers, both in this area as well as some of these public health areas, and we may see EPA trying to reverse the progress that's been made by the Obama administration. I hope not. We have to press for more. But there are areas where I still see hope in dealing with climate change. I don't think they're going to return to using coal for our power plants in the private sector. It's too expensive. It's wasteful.
Right.
So wind and solar energy, renewable energy is still going to be used. It's going to be more valuable for our electricity needs. I think we're seeing states like the state of California look for opportunities to do a cap and trade bill to lower the emissions that cause climate change, and to do it not only within the state, but to ask for other states to join them. I think we are going to see more and more concern by the American people about the severe climate episodes that we have been experiencing, and they'll be demanding that we do something about it, not just to deny it. So we could be set back irretrievably, but I refuse to accept that conclusion, and we'll have to use all the tools at our disposal to continue moving forward. We should not reject what was agreed to in Paris, which was an international agreement where everybody was going to work together on the international scene to get countries to reduce their emissions that cause the heating of the planet and the climate change that's resulting from it. And we certainly shouldn't be stepping back from that. We ought to do what we need to do. Otherwise, we'll see a lot of countries taking the attitude that we took for decades now after the Kyoto Agreement. Now, why should we do something if nobody else around the world is going to do something? Well, now that we're getting the rest of the world to act, it's not time for us to say we're going to relax our efforts, because we all live on the same planet. We all share the same atmosphere, and we're all going to suffer from the same consequences if we don't take action together.
Inspiring. So, Bill, final words?
Final words following up on what Henry just said, and I want to repeat something he said earlier. Speak truth to power, and I would amend it saying speak truth, evidence, and science to power. Now's the time. We've been in these situations in the past where there have been very serious challenges to priorities that we care about, and we've got the truth and the evidence and the science on our side, and we've just got to make sure that everybody who's responsible in our government is hearing it.
On both sides of the aisle.
Yes.
Well, that's a great way to end it. You know, I would paraphrase your closing statements as saying to Trump, America has to lead, right? We've been leading these issues. We have to continue to lead, because as we go, so does much of the world. We're a role model and influencer. Good. Well, you know, it's been great to have you on this call. I'm sure the 1,000 people who were listening are equally appreciative. I apologize that we couldn't get to all the questions, but they were good questions, and I want to thank you for your insight. And we're proud to be in the trenches with both of you, working to advance the nation's public health. And thanks to everybody who listened in today. Thanks.
Thank you, Mike.
Thank you.
Okay, bye. Okay, bye.